Hello everyone, welcome to sqadia.com, and in our third section of the lecture topic, Endoscopic Surgery in Gynecology, we will talk about some surgical techniques. In this we will talk about tubal sterilization and then total laparoscopic hysterectomy and laparoscopic assisted vaginal hysterectomy. So for surgical techniques is patient positioning is important, and then next step is production of pneumoperitoneum. So air is introduced into the peritoneum, and after that there is introduction of trocar and cannula, and then through that then introduction of laparoscope, creation of accessory ports. These are the accessory ports here. Then surgical procedure is carried out after all these openings are created, and then after surgical procedure is carried out, then there is deflation of peritoneal gas, which was first introduced, then it is removed, and then after that there is closure of the parietal wound or ports, accessory ports. So this is just the step to start the surgical procedure. Positioning of the patient, anesthesia is given, and then ports are created. After that, then gas insufflation is done, in which the pneumoperitoneum is created. After that, there is insertion of trocar and cannula, and then the trocar is removed, and instead of that, laparoscope is inserted. After the surgical procedure is performed, then the pores are, accessory pores are removed after the gas is removed. So some surgical technique, this is the burning of the ovarian cyst here. You can see just the diathermy, and in this again, this is the procedure done to remove the adhesions. Adhesions are removed. Then three operative laparoscopy procedures done. First is tubal sterilization with single puncture technique, and then total laparoscopic hysterectomy, and third is laparoscopic assisted vaginal hysterectomy. So hysterectomy can be performed through vagina or through abdomen. So both can be performed by laparoscope. So tubal sterilization with single puncture. In this picture, if you see, first step is fallopian tube is stabilized with Babcock clamp. Here, these are the clamps, and fallopian tube is held in between the clamps, so it cannot move. Then after this, then hemostat pass through avascular portion of mesosalpinx. Here, hemostat. Hemostat is the instrument used to clamp so bleeding should not occur. So hemostat is used to clamp the bleeding vessel. Then ligation of the tube, double ligation. You can see here, it's ligated here, and then it's ligated here. This is the hemostat clamp. This is double ligation. Then after this, tube is divided. Between the ligation, they cut the tube. Here, tube is divided. This is tube is divided. And then myometrial pocket is created, myometrium. is the muscle layer here. It's a small pocket or a hole is formed, pocket is created, and then needle is inserted in the base of the pocket, and then finally what happened is proximal portion of the tube buried in myometrium here. So this is sterilization, tubal sterilization with single puncture. Very, very simple procedure done by laparoscopy. So tubal sterilization is performed to achieve permanent sterilization, in which fallopian tubes are tied and then cut in between the two ties, and then myometrial pocket is created, and then one end, proximal end of the fallopian tube is embedded and stitched in the myometrial pocket or buried in the myometrial pocket. And this is one portion left. So if there is no fallopian tube, it's tied and cut. There is no passage of ovum to the uterus, and then no fertilization and no pregnancy. So simple tubal sterilization is performed by the laparoscopy. First clamped, so it cannot move. Then hemostat is applied in the center, mainly to stop the bleeding that occurs with the clamping and here ligation and cutting. So with the clamp, it's ligated and then it's cut. So this is all the steps for tubal sterilization or tubal ligation. This is the picture, tubal, this is the ring. This is another method of achieving tubal sterilization or tubal. Here, laparoscopic view showing tubal sterilization with silastic ring. In this, the ring is applied and that can block the fallopian tube. Then another procedure done by the laparoscope is total laparoscopic hysterectomy. Total hysterectomy. In this first picture is this is the total hysterectomy done, in which the uterus is removed only. Here, this margin is only the uterus is removed. Total hysterectomy is performed, and then it can be total hysterectomy with salpingo-oophorectomy, and in this, uterus and ovaries and fallopian tubes all are removed. Total hysterectomy with salpingo-oophorectomy. In this radical hysterectomy, again, along with fallopian tubes, ovaries, uterus, this portion of the cervix is also removed. Nearby tissue is also removed. So it's little more extensive hysterectomy, radical hysterectomy. Two types of incisions are done to perform hysterectomy. It can be low transverse incision, this one, or it can be vertical incision. Low transverse incision is preferred because it's lower, less visible, and instead of vertical incision. But if more extensive procedure is performed, then vertical incision is usually preferred. Then laparoscopic assisted vaginal hysterectomy. Hysterectomy can also be done through vagina, and if it's performed through vagina, hysteroscope is inserted through the vagina, and then it can be hysterectomy, uterus can be removed. This is all the pictures showing about round ligament, ovarian ligament, ovarian artery, fallopian tube, ureter. Ureter is very, very close to the fallopian tube. So sometimes accidentally, when tubal ligation is performed, ureter can be ligated or cut. That can lead to serious complication leading to no urinary output. So this is the hysterectomy done through vagina, removal of the uterus. So that was all about the tubal sterilization, total laparoscopic hysterectomy, and hysterectomy done by the vagina. Thank you for watching sqadia.com.